It's a big problem, actually, because as you know, we are facing with a dramatic increase of chronic disease. That means that we will have to manage many, many patients and much more in the next future. In the same time, we are facing with a dramatic decrease of the resource, available resource, in terms of human resource as well as in terms of economical resource. That means that we need the help, and this help can come only from technology, which will be, for, of course, e-health, digital health, and for implantable device population. This is a very important topic that algorithms such as HeartInsight will try to solve. That's what I believe strongly. It's a great one, because one of the main issues we should take into account when we manage this kind of patients, in which we have to analyze plenty of different parameters. That's what we need in order to be effective. We need help that will also transform all this information in a very simplified and fluent work burden and workflow. And so artificial intelligence implemented in the implantable device, of course, will help us to stratify the information in order to dedicate our attention only to those patients that really need to be followed up in a strict way. And to follow up this patient very strictly, it's the only way we can achieve the target to avoid the continuous decompensation and hospitalization. So we can flat the famous curve that is picturing classically the course, the end of the life of these heart failure patients. If we want to flat this curve, the only way is to follow up them very strict. And this kind of algorithms with a composite single alert will help us, and are already doing it, in order to achieve this target. If we are safe, confident with the performance of the algorithm, we know that we can focus our attention and our resource, which, as I said, they are not infinite. We can dedicate them only to patients that have an alert, because we believe and we know that this alert is true. And to all the other patients that have not an alert, are not in an alert state, we can follow up a standard without using a lot of our time and a lot of our resource, which can be dedicated only to those patients that needs to be followed up strictly. What patient ask to technology, from technology? They want the technology that allows them to live automatic, to be followed up in an automatic way, and to be out of the hospital as more as possible. They don't want to see us so often. They want, of course, they want to do this feeling safe. And this kind of algorithms allows the chance to follow up the patient, leaving them live their chronicity in a very high level quality of life. Okay, and so for them, the impact, I'm sure, and I know from my experience, they really accept very well this kind of follow-up, because they feel safe. They know that we are behind them, taking care of their acute events or whatever, that we are able to prevent. We would like to do, actually, more and more. And so it's a good impact that on their quality of life. Detection was the past, because since we implemented in our clinical practice remote monitoring of devices, we know that we could shift from an electronic analysis of electronic data like threshold, pacing threshold, or sensing impedance. We soon understood that we could move to a detection of clinical events. Okay, so detection is something we already know since 20 years that we are able to achieve. The present, I would say, is prediction, because thanks to HeartInsight and this kind of algorithms, now we are able to understand before what is going on. The next step, so the future, maybe will be to prevent, really to prevent. What is the difference? That to prevent, we need to know that something is going to happen, and to also know which kind of action we have to undertake in order to avoid that this acute event is going to happen. And this is the next step. in my opinion, if we talk about patient wearing implantable device, it will be exactly in the heart of the digital health for this kind of population, because it's a very powerful tool. Of course, we need to get enough clinical experience. We wait for further data to be published. But what is really interesting and is promising is that this kind of algorithm is not just a gadget. This is something that I'm sure will dramatically impact in our way to follow and to manage this kind of patients. And so I'm really optimistic that it will be the fulcrum of our management of heart failure patients.